multiple myeloma update from the 2011 American Society of Clinical Oncology annual meeting. We have the pleasure today of speaking with several key presenters from ASCO, Dr. Rafael Fonseca from the Mayo Clinic in Scottsdale, Arizona, and Dr. David Rudman from the University of Pittsburgh Medical Center in Pittsburgh.
If transplant is the intent, and as Dr. Rudman already mentioned, I do believe the issue is settled. You have to go for the best response if you're going to take the patient to transplant. Now there's a caveat to this. That intent is at the time you decide to start therapy. So that means you choose the best therapy that can get you into that complete response.
There's really been some tremendously provocative data coming out of the MRC9 trial. What came out of that finding was the recommendation from that group that all patients, regardless of bone disease status, get treated with zoledronic acid as part of their regimen. I think to change guidelines currently is premature until we have more data.
This is a very exciting new stage in the treatment of multiple myeloma. Dr. Loniel has said before that myeloma is the only tumor that produces a monoclonal antibody, and yet we have no monoclonal antibody to treat it. Others have said we need a Rituxan-like drug for the treatment of myeloma, and clearly we're moving in the right direction.
So I think it's a very, very exciting agent that will probably be available, I think, in the next year or so, I hope, for most patients with myeloma. These data point out the fact that myeloma is a heterogeneous disease, and we have to identify the different biologic characteristics if we're going to treat patients appropriately and select the appropriate agents to treat them with. We now have many more agents than we used to have. We have the old novel agents and the novel agents coming into play, and I think work of Dr. Fonseca and others who are really looking into the basic fundamental biology of myeloma cells will help us to tailor therapy, limit toxicity, and increase our response rates.